What imaging methods identify osteosarcoma subtypes in vivo? Imagine trying to solve a complex puzzle without seeing all the pieces clearly. That's similar to how doctors approach identifying osteosarcoma subtypes inside the body. While imaging tools are vital for locating and understanding these tumors, they currently cannot definitively distinguish specific osteosarcoma subtypes in living patients. Instead, imaging helps reveal where the tumor is, how big it is, whether it has spread, and how it responds to treatment. To truly identify the subtype, a biopsy and microscopic examination are essential. The first step often involves plain X-ray images. These are quick, accessible, and usually the first test ordered when a bone tumor is suspected. X-rays can show characteristic signs of osteosarcoma, like areas of bone destruction combined with new bone formation, often giving a mixed picture of destruction and sclerosis. But X-rays alone can't tell us the exact subtype of osteosarcoma, as many types look similar on these images. Magnetic resonance imaging, or MRI, is the most detailed tool for examining the tumor's local extent. It provides high-contrast images of soft tissues, helping doctors see how far the tumor has invaded the bone and surrounding muscles or joints. MRI scans are performed in multiple planes, axial, sagittal, and coronal, and include different sequences like T1 weighted, T2 weighted, and stir images. These help define the tumor's boundaries and check for skip lesions, which are separate tumor areas within the same bone or across joints. For detecting metastases, especially in the lungs, which are the most common site for osteosarcoma spread, a computed tomography scan of the chest is used. It provides detailed images of lung tissue to identify small metastatic nodules that might not be visible on other scans. Bone scans using technetium-99 methylnitaphosphonate are also common. They involve injecting a radioactive isotope that accumulates in areas of high bone activity, highlighting both the primary tumor and any bone metastases. This whole body scan helps assess the full extent of disease spread. Advanced imaging techniques add more depth to the evaluation. Positron emission tomography, or PET scans, measure the metabolic activity of the tumor. Cancer cells often have higher glucose uptake, so PET can help identify active tumor tissue, detect recurrence, and evaluate how well treatment is working. Diffusion-weighted MRI is another powerful tool that looks at how water molecules move within tissues. It can help distinguish valuable tumor tissue from necrotic or dead tissue after chemotherapy, providing early clues about treatment response. Proton magnetic resonance spectroscopy is an emerging technique that analyzes the biochemical composition of the tumor, offering additional insights into its nature. Newer methods like photoacoustic imaging and diffuse optical spectroscopy are still under research but show promise for mapping tumor progression non-invasively. While all these imaging methods are invaluable, they do not currently allow doctors to determine the exact osteosarcoma subtype inside the body. Instead, they help guide biopsy procedures, plan surgery, and monitor how the tumor responds to treatment. The definitive classification of osteosarcoma subtypes relies on microscopic examination of tissue samples, which reveals the tumor's cellular characteristics and grade. In summary, imaging techniques like X-ray, MRI, CT scans, bone scans, and functional imaging such as PET are essential for evaluating osteosarcoma. They help locate the tumor, assess its spread, and monitor treatment effects. However, identifying specific subtypes in vivo remains a task for pathology. Always consult healthcare professionals for personalized diagnosis and treatment options, as each case can vary widely.